Drug companies are highly incentivized to keep drugs out of generic so that the prices come down. They do a game. I know this because I was involved in exploring drugs for eye disease years ago, and I would learn from these companies. If you can have a drug that goes through all the research and development, costs millions of dollars, and then is used, say, for the treatment of a heart condition, if you can bypass the need to do all the safety studies because you discovered that that drug is now also useful for, say, preserving vision in macular degeneration or glaucoma or diabetes, whatever, you save yourself a lot of money. Same drug, you maintain the patent, and you can't have generic competitors. So drug companies, I don't think people talk about this enough, are highly incentivized to not discover new drugs, but rather to continue with the same drugs and find new uses for the same drugs.
Wow.
That's rarely talked about. That's a serious problem. The other thing about drug companies
because the negative side effect of that is what? That something gets kind of shoehorned in and working for something, but the
very expensive drugs for everybody. Because if you look at the difference between there are these new sleep medications called the DORAs. They shut down the wakefulness system as opposed to making you sleepy. They have a lot less abuse potential. They're like $300 a month. And as long as they can maintain the patent on that, there won't be the generic version because it probably costs, the profit margins on these things are huge because they're trying to cover the research and development they did. There's, so that's just one example. But the drug companies are incentivized